Okay. All right. So first, can you just okay. So she's on a bed. You know, she's on a gurney. Yeah, maybe here. I'm gonna have to actually get you down on the chair in a moment. Okay, I'm gonna just touch your head. Okay, first off. Okay, so I can see that her hair is well distributed. I'm just gonna touch your scalp. So tell me if this hurts you. I don't feel any masses, any tenderness. Is this hurting in any way?
That's good.
No? Okay, very good. And so that's her hair and her scalp. Her head is aligned, proportional to her body. And so can you move your head in the range of movement? So bend forward. Good. Bend back. Okay, turn over, turn like this. Turn like that. Good job. Can you lateral side bend? There you go. Good job. Okay, so does this hurt you? Temporal mandibular joint. Good job. Okay. Oh, the one thing I didn't do is the whisper test, okay? So can you plug your ear, just like press your tragus right here, press the front of your ear, and I'm gonna whisper 3 words behind you and repeat what I say.
1, 2, 3.
Good. Can you press the other ear? Repeat what I say.
4, 5, 6.
Good. So that's the whisper test. I do need to tell you how to do the Reber and Renee in just a moment. I still have 20 minutes of the class. Okay, good. And then I'm going to also now touch your lymph nodes, preauricular, postauricular, occipital. And I'm looking for tenderness. Tell me if this hurts you in any way. I don't feel any masses. Submandibular, submental. Does this hurt you in any way? Turn your head that way. Posterior cervical, superficial cervical, anterior cervical. Turn your head this way. There you go. Okay? Posterior cervical, anterior cervical, superficial cervical. Okay, very good. And I'm just going to touch your supraclavicular lymph node. So your patients are going to have gowns on, just so you know that, okay? And I don't feel any masses, and does it hurt you in any way? Very good. So I'm going to need a tongue blade. Sorry, guys.
Guess I'll have to share these videos with your classmates who aren't here.
Oh, yeah, no.
There, it wouldn't be fair.
Well, they left already,
Well,
right?
I know, but I told them they could.
Okay, so now I'm gonna just say oops. Light. I need a light. Okay, good. Here you go. Good. Sorry. I'm gonna look at her gingiva. I don't see any ulcerations. Her teeth are all present. I don't see any apparent caries. Her gingiva. Her tongue. Good. No cracks. No lesions. No ulcerations. Okay, say for me one more time. Her uvula is midline, and I don't see any kind of sores on her tonsils. Okay, and any sores to your pharynx, and then I don't see in your palate moves appropriate when you say ah.
Great.
Very good. And so let me go ahead and now I'm going to take a look in your
The
ears.
rubric has them palpate the mouth too.
Oh, like with the tongue blade.
Well, I thought it was with a glove on.
Oh, I guess you could, but okay. So, so I'm going to take a look at her ears, and first I'm going to see that there's no lesions to her auricle, no obvious discharge. I'm going to palpate her ears. Does this hurt you?
No.
Does this hurt you?
No.
Okay, her auricle, her tragus, does it hurt you?
No.
Mastoid process, does this hurt you? Any tenderness? No. I already did her lymph nodes, so I'm going to move on to the external canal. Okay, I'm going to pull back, brace her head with my fingers, pull on her auricle. I'm going to take a look in her external canal, and I see that her tympanic membrane is pearly gray, and I see the cone of light. Okay? Now I'm going to go over here, onto this ear. I'm going to see that her auricle, there's no inflammation, no obvious lesions. I'm going to press on, and then no discharge. I'm going to press on her tragus. I'm going to pull on her auricle. And does that hurt you in any way?
Nope.
I'm going to touch her mastoid process. Does this hurt in any way?
Nope.
Good. Then I'm going to do the external ear exam. Okay, good. And I see her tympanic membrane, which is pearly gray, and the cone of light is present, and I see the landmarks. It's great. Now I'm going to take a look at her eyes. But can you take your glasses off for me? So I see that her eyebrows are symmetrical, evenly distributed. Her eyelashes also, hair distribution evenly distributed. I don't see any discharge coming out her eyes. Her bulbar conjunctiva is not red or injected. Her sclera is white. Her eyes are blue. Her pupils are even and symmetrical and round. And then her bulbar or her palpebral conjunctiva it's pink and not red or inflamed. Okay? And so can you close your eyes? I'm going to just kind of touch your eyelids. Does this hurt you in any way? Nope. Nope? Okay, very good. So I'm going to just kind of take a look at her eyes. All right, so if I had a trash can, here, let me just throw this away. So remember to throw away your specky ones in your tongue blade, okay? Okay, so just look at me. This is direct. I see that her eye constricts. This is consensual or indirect. This is, just look at me, don't look at the light. This is direct, and this is indirect, okay? Okay, so I just make sure that I'm in even position. Her eyes are basically just directly across from me. I'm gonna do extraocular movements. Okay, so just look at me, keep your head still, and follow my finger. Okay, very good, thank you. And the extraocular is the eyes. Okay, so, and now let me go ahead and, cover and uncover test.
Fresh life test only if indicated.
Yeah, so the cover and uncover test is definitely this, but the visual fields, okay, so here, look at me. Okay, so her eye does not move. Cover and uncover test, her eye does not move. Very good. And cover and uncover test, eye, visual. So let me go ahead and do peripheral vision. Vision fields, this is only if you have an eye complaint, okay? So just look at me, keep your head still, and just follow my finger only with your eyes. So here we go, just follow my finger only with your eyes. Very good. This is to test for cranial nerves 3, 4, and 6. Okay? Very good. Okay? So that's peripheral vision, peripheral fields.
That was extraocular movements.
Oh, I'm sorry.
So you want to do
Extraocular
visual fields
movements.
with the fingers from behind.
Sorry about that. That was extraocular movements, guys. Sorry about that. Extraocular movements. Oh, getting you all confused. You know that's extraocular movements, right? Okay. So now
Cranial nerve test.
Yeah, this is right, and that is one of the testable things. And so then you have peripheral fields. So just look at me, and then just kind of close one eye, very good, or cover one eye, and tell me when you see my finger wiggle.
I can see
Okay,
it
just
from
look
the
at me.
beginning.
Yeah.
Okay.
Can you see this?
Yes.
Good. Tell me when. Can you see it?
Yes.
Okay, good.
Yes.
Okay, good.
So I do it from behind the person's head.
Okay, here.
Yep. There.
Okay, good.
There. There.
Okay, good. Yeah, I do it kind of in between, but as long as you're not up here in the front of them, just sort of in between. But nonetheless, it's a very objective, subjective test. Did you guys get me? Is there anything else that I missed? Oh, that's topic. So then, so you do have these already.
Well, of course, the instrument. We haven't. She didn't do anything with the instruments yet.
She looked in my ears.
The Weber?
So
we do that,
I
Weber?
would dim the test.
She did. No.
I would dim. Hold on. I would dim it. So it's right. Dim the light, and then it's right eye, right. So left. So this is her left, and then this would be to my left.
This
okay?
is my right.
And this is your right. That's it.
This is my
That's
right. You're
Right.
gonna use your right and your right.
Okay.
Okay.
So I do not like to use. So then red light. Just look straight ahead. Don't look at the light. So red light reflex is present. Okay. And I see that her red light reflex is present. Okay. All right. What else did I miss? Oh, the Weber and Rene is though only
And then
if you have
do
a
the
hearing
fundoscopic
test.
If it's an eye complaint, right? Or they do
Yes.
it anyway. You
They
want
do
them to
it
do it
anyways.
anyway.
Mhm.
Do you do the Weber anyway?
No, but you want me to show you how to do it?
Yeah, sure.
Okay.
Okay.
So I'm gonna just press. I'm gonna hold this up to your forehead and tell me if you hear it in both ears or one louder than the other. Okay.
It's equal.
Equal. Okay. Very good. Yeah, and if they did, and then I'm gonna hold this behind your ear and tell me when you no longer hear the sound.
Now.
Do you hear it now?
That's funny. No.
It's air conduction.
I may have an air
She
conditioning
should.
problem.
Yeah, so she could have a. Okay. Well, that's how you.
That's how you do it.
I'm not
Should
here to
be
diagnose
2
you.
to 1.
Did she do the TMJ?
Yes, I did.
Oh, good.
Yes.
Okay, I do.
Anything you need me to show you?
Interestingly, in the video, she calls it the Rin test, and I've always called it Renee.
She
Renee.
did
Renee,
the
right.
I think she did.
I've
all
always
of it.
called it Renee.
Me
She calls
too.
it
Neck?
Rin
Does she do the
in
neck?
video.
Oh, the neck. The neck.
I did do.
You did the neck.
I did the range of motion.
Oh, you did the
And I
neck.
didn't do
And
the
lymph
trachea.
nodes. Trachea.
Trachea.
I didn't do the trachea. Your trachea is
Trachea.
midline. And can you swallow for me?
Trachea, she didn't do.
And then I don't, and thyroid. Swallow for me? Okay,
Yeah. Did you practice thyroid with them?
I did.
Yeah, we did. So